Port Moody Fire Rescue has a new ring rescue kit with 2 devices inside that are going to help with the removal of stuck rings for our patients. Our first device is the compression device. And this is going to be our first choice for trying to remove a ring from a patient, as it's non-destructive. So Adam here has a stuck ring on. Okay, and I'm going to ask him a few questions here to determine what kind of procedure we're going to be following. So Adam, how long has the ring been stuck for?
Under 2 weeks.
So if it's less than 2 weeks, we're calling it an acute case caused by fluid buildup. And that's going to be 1 round of compression for 5 minutes, where his arm is at 90 degrees. If he tells me that it's been stuck for longer than 2 weeks, we have a chronic case where it's now caused by tissue buildup. And we're going to do 2 to 3 rounds of compression for 5 minutes each, and we're going to rotate the device slightly between rounds. We want to minimize the time between rounds to 5 to 10 seconds. The third question we're going to ask if they've attempted removal at home. And if they've tried at home to remove the ring with dental floss or string, he has a case of angry finger. So we want to ask our patient to come back in 1 week after the swelling and redness has decreased from the angry finger. It's going to make it easier to remove at this time and more comfortable for the patient. Again, it's 2 to 3 rounds of compression. Each round is 5 minutes for angry finger. And you're going to want to do at least 2 rounds of compression before attempting any manipulation. We can do a maximum of 4 to 5 rounds before we move on to our second option, which is the dolphin ring cutter. Shrink the finger by applying the compression device. Okay. The device does not go over the ring, but butts up right next to it. So it's right next to it. And now we're going to inflate the compression device until that needle is in the turquoise colored area, or around 6 o'clock. All right, so you can see it's just a touch before 6 o'clock. We're going to get our patient here to put their arm at 90 degrees. And we're going to start our 5-minute timer for our first round of compression. This being an acute case, because it's been less than 2 weeks, there's good chance that we'll be successful at removing the ring after 1 round of compression. 5-minute round of compression is complete, so I can bleed the air. Okay, considering there's an acute case here, we're going to try attempting removal after 1 round of compression. We're going to apply a little bit of lubricant, and you want it to keep a minimal amount here, only lube near the ring. Too much lubricant will make it challenging to get a grip on the ring. Try that. So removal techniques, there's 3 ways. There's a rotational or corkscrew method, where we're just going to kind of slowly twist the ring, okay? Or there's more of a rocker method, where there's no twist, but kind of just rocking it back and forth. Or we can try a counter traction method, where it's more of a pull, okay? And it looks like it's gonna come right off right now. Got to be a little more cautious here when we get to the knuckle. Communicate with our patient. How's it feeling?
Stuck.
Okay, still feeling stuck? Okay, I'm gonna try the corkscrew method. Applying a little bit of rotation here.
That's fine.
Is there pain?
Nope.
And it's coming right off. So if the compression device was unsuccessful in removing the ring, we're going to move to our second choice, which is the Dolphin ring cutter, which is going to destroy the ring. We're going to make 2 cuts on the ring. First, we're going to remove the thumb screw to install a cutting disc. We're going to do this with the power off. Reinstall the thumb screw. Make sure it's nice and secure. There's a power switch. Right, I'm going to turn it on now. You have a open and close button. So that's going to allow me to fit the finger guard under the ring. So right now I'm going to open this finger guard. Finger guard lowered. I'm going to make sure the ring comes into contact with the backstop before I bring the cutting disc into contact with the ring. So I know the finger guard is in contact with the backstop. I'm now going to use the up arrow to close the gap between the cutting disc and the ring before I make my first cut. So the device cuts automatically. You don't need to apply any pressure. I'm going to want to apply a little bit of lubricant before I start my cut to the cutting disc. So I'll just give it one spray here. Each cut takes about 2 to 6 minutes. And now that I know that the disc is in contact with the ring, I'm going to go ahead and pull the trigger on the device and the cut is going to start. You'll notice that we have green lights here. That's your progress indicator for how deep you are through your cut. The green light. There's also a blue light every 30 seconds that reminds you to apply more lubricant. So the cut is complete when all green lights are illuminated and flash green. We're about 70% of the way right now. Blue light reminding me to apply more lubricant to the cutting wheel. Green lights are all illuminated and flashing. It means we've completed the cut. How we doing, Adam?
Good.
So I'm going to open the finger guard. I'm going to remove it. We've completed our first cut. I'm going to rotate the ring. And I'm going to repeat and make my second cut. Finger guard installed against the backstop. Bring the cutting disc into contact with the ring. And I can go ahead and use my trigger to start cutting. All green lights are illuminated and flashing. We know the cut is complete. I can go ahead and open up the finger guard.